I like keeping it in-house, not because I'm jealous of samples of my activity, but just because I think that it is a kind of investment that you do that pays off a lot over the years in terms of knowledge, in terms of education of your people, and in terms also of reward that you get for your patient, for your medical oncologists that of course value the activity that we do in the lab. I think it is very rich to keep, let's say, complicated analysis in-house. It also helps get more frequently to a very good results, because sometimes there may be issues related to samples, so we could go back rapidly to look for another sample, to suggest to collect another type of sample, tissue versus liquid. So I do think that patients in the end benefit most from an in-house test, and also we get a lot of knowledge in the end. One was a very young patient that had most likely a hereditary syndrome that was actually misdiagnosed. So it came to our attention, and we started from the sample, from the tumor samples. But then in the end, by sequencing high throughput with a comprehensive genomic profiling, we managed also to realize that there was a hereditary syndrome behind the onset of his disease. So we helped the patient clarify exactly what was behind this very early onset of multiple colorectal cancer that was diagnosed in this patient when he was 16 years old. So it was a story of success because through the samples we actually realized that the story was more complex than we expected, but he also had a chance for therapy thanks to the comprehensive genomic profiling that we actually performed. There are a couple of examples in which the added value of performing comprehensive genomic profiling was really that we sequenced for a reason, and then we came out with a genetic alteration that was unlikely to find, but was there. So in the end, for those two patients that shared actually the same genetic alteration, there was a therapeutic option.